Hello, my name is Sebastian Turner, and today we're going to be talking about epidemiologists. In the vacancy that I was able to get a hold of from the CDC, the epidemiologist would serve as the recognized expert in epidemiology, which means they would be asked various questions about what diseases employees at the embassy had to worry about and things like that, about immunizations. But they'd also manage significant projects, programs, and staff, and would represent the CDC while at that embassy. They would also utilize data collection, quality control, and data utilization methods used to study epidemiological problems and issues in their local area. And as medical practitioners, they would of course comply with all ethical guidelines for scientific and human subject research. Also, on top of all these other duties, they would also oversee contracts, grants, and cooperative agreements with full responsibility for carrying out all required monitoring and management duties for epidemiological work. This usually means that they would help out in ensuring that charity projects and that money that was being spent to help out the people actually went to the people. But on top of that, they would also design and plan and initiate epidemiologic studies, surveys, and investigations, which would mean that they might look into see if a disease was becoming at epidemic levels, and they might serve as national or international recognized experts on the epidemiological issues on critical problems in the field of epidemiology. In order to be an international, the work environments of epidemiologists tend to be in the laboratories, where they're conducting tests and running simulations and things like that. But they also, in this case, would work in an embassy where they would be trying to deal with all the public problems around their location. But they might also be working in the field, taking interviews and doing data collection for many of the people they usually use as statistics. The list you see below is just some of the countries that were recognized as needing an epidemiologist at those embassies, but there are many others. The picture you see to your right, that is an embassy in Egypt. There are a great number of challenges that epidemiologists tend to face when trying to do their work. For example, they're likely going to be dealing with a large amount of people that do not speak English as a native. And if they're in a third world country, chances are the data collection of how many people are dying from a specific disease is going to be very little. So recognizing when an epidemic happens is going to be very difficult. And when those things happen, they need to then educate the entire staff on protocols, on what to do if this person that comes in sick is a citizen or not, or whatever happens. Not to mention, they are also going to be able to have to identify normally isolated diseases compared to common ones, given that new emerging diseases are happening every day. And of course, they're going to have to keep up-to-date knowledge on protocols for disease prevention and infection control, as cited by the CDC. Some of the rewards that epidemiologists can expect in their work is if they do a good job, they'll know that they helped a lot of people, they're going to get paid a very good salary, they might get recognized for their work, they'll have travel opportunities, obviously, and government benefits, which could mean health insurance, pay and leave, among many other things. For example, when it comes to being recognized for one's work, Lieutenant Caitlin Cosboom was honored by the CDC for her veterinary work in preventing zoological diseases from spreading. Or Diane Caves, who died in the Haiti earthquake and helped in the HIV and AIDS epidemic happening in that area. These are my references. Thank you for listening.